Hey everyone, welcome to McKeeman Communications Live After Lunch. I am Shannon Sadler, the newer face on the team. I'm a senior account executive with McKeeman, and we have been doing these series for over the last couple months, really just to showcase and highlight how different businesses are navigating through the pandemic, and to learn from each other about the communications tactics, that might be working for some, or even some of the challenges that people have endured over the last couple months. Just kind of as people are joining, hey Carrie, give me a wave if you can hear me and everything sounds good. We're really excited today to sit down with Andrew Herrera and to highlight our first nonprofit of the series, which is Cure Americas Global. They are based right here in North Carolina, in Raleigh actually, and we're also really lucky to call them a client. Andrew is the executive director of Cure Americas. He has a BA in Hispanic and Religious Studies, a Master of Public Health, and a degree, and he recently just finished his MBA. Holy cow, Andrew, that's amazing. A little bit about Cure Americas while everyone joins in. Hey Katie, hey Becky. So Cure Americas was founded in 1983, and its mission really is to provide hope through health across the globe, including right here in North Carolina. They've worked since 1983 to save the lives of women and children in forgotten communities. They've reached over 1.7 million people in a lot of the rural parts of Latin America and Africa, and across 37 years in 7 countries. So today they are navigating the pandemic and serving the Latinx community and forgotten communities right here in North Carolina, really to provide COVID-19 education and resources, and really just be an ally for those people who might not know how to navigate it themselves. So I am going to see if I can get Andrew on here. Give me 1 second. Perfect. All right. Hey, Whitney. Just waiting for Andrew to jump on. Hi.
Hi, Shannon. How are you?
Good. Can you hear me okay?
No problem.
Awesome. Well, welcome. Thanks for sitting down with us today.
Yeah, it's good to be here. Thank you.
Yeah, and I'm just having everyone kind of give us a wave as they enter. Also, you guys, as we're going through, these conversations, feel free to drop a comment below, and we'll be sure to answer as many as we can in the half hour that we have. So, Andrew, I'm ready to get right into it if you are.
Let's do
Perfect.
it.
So knowing that Cure Americas, does a lot of work, most of their work across seas, how did you and your team initially shift when this pandemic began?
Yeah, it's a great question. The pandemic hit pretty quickly, but one of the keys for us is having trusted relationships with partners. And so being able to work with our partners to meet their needs. And one of the ways I talk about partnership is really listening, and not just listening, but acting on what we hear. And so through our partnerships around the world and here in North Carolina, we immediately started understanding and asking, what do you need? What will make your life easier? How do we make sure we utilize the networks that we have in place and leverage the relationships that we have in place to keep going, but to go differently? And we had to, that word that my wife makes fun of me every time I use it, pivot, right? To
Yeah.
this hardcore pivot. And
Yep.
that's what we've been doing, is really not just sitting back and letting it happen to us, but really moving forward, running ahead to say we have to do something. What can we do to stay relevant and to be helpful for our partners? And it's worked out really well. We're really lucky to be able to change a lot of what we've done and go virtual in so many ways.
And I know a lot of your work is, kind of boots on the ground work in a lot of those other countries. Can you provide like some specific examples of how you guys had to shift some of that work, especially, pinpointing COVID resources and getting that education to those communities. How did you have to shift that way with kind of the boots on the ground tactics?
Yeah, so I would say we were really, we had gone through this before, and we had dealt with Ebola in Liberia.
Right.
And so we understood what a pandemic meant and what communities needed from that experience. What Cure Americas does really well is set up networks of community members who are owners of their own health. And so these networks focus on the most needed health issues, the health priorities. Sometimes in that community, it'll be water, or it'll be a health facility or a community health worker. But across nearly all of our projects, the focus is on moms and babies, surviving, giving birth, surviving the first year of life, and thriving. That's been our messaging. And so we have across the world, literally hundreds of moms teaching moms. And so we usually focus on things like prenatal care, taking your prenatal vitamins, getting your prenatal checkup to be prepared for emergencies. And then after the baby's born, making sure the baby has healthy nutrition, focused on exclusive breastfeeding, things like that. That's how we have saved lives over the past 38 years. But with the COVID outbreak, we knew we had to change the messaging. And so really in week one, our public health experts developed educational materials to go down all the way to every mom teaching mom. Instead of focused on prenatal vitamins, we shifted rapidly to COVID prevention. What is COVID? How do we stay safe? How do we prevent it? So really by the end of March, all of our communities around the world were insulated. They were prepared. They had education and materials, but not just the education. We also worked on the actual materials that they needed, the supplies that they needed. And so when we talk about in the United States, the focus on hand washing, easy to do here. Every time I open up the tap water at my house, it is a true miracle to have unlimited hot or cold water. It's crazy. I don't know if we realize that, but there are hundreds of millions of people without access to clean water. And so washing your hands is a little bit more complicated in those settings, right? And not just learning how to do it, counting to 20 and singing the birthday song a few times, but where do I get clean water from?
Yeah.
So go ahead.
And a lot of that too, I imagine, since there's already, I guess, for lack of education, dispelling some of those myths too about COVID. So I'm sure some messaging had to be, part of that as well.
Certainly. I mean, one of the questions people asked is we have to say social distance. What does that mean? Nobody even knows what the words mean to social distance. And how do you translate that into a Mayan language in the highlands of Guatemala? Yeah. How do you translate that into Swahili? So definitely education was important. Some of the communities we work in, we're teaching germ theory, that you get sick from germs, from microscopic organisms that we can't see. But I wanted to mention that for hand washing, it's important to realize that we taught moms how to build hand washing stations from locally available materials for free, and how to make soap at home. And so not only are we giving education, but we're building skills. Today, moms are selling those hand washing stations to their neighbors. Their entrepreneurial spirit is kicking in. They're motivated, and they're making soap to share with their friends and family. So not only do they know they have to wash their hands to stay safe, but now they know how to do it. They can do it.
I love that. We did have a question come in from Kim. Hey, Kim. Businesses are being stretched. People are watching how they're spending their money, including donations. What kind of response are you seeing from donors?
Yeah, absolutely. We have definitely seen a 40% reduction in donations. So the economic uncertainty in the world that we live in is not getting better. It is hitting everybody. And that's affecting, that uncertainty is affecting people's willingness to give as they're looking out for their future. Who knows if I'll have a job, right, in 6 months. So that's been tough. But I also have seen an incredible outpour of people interested in helping. And so we in the North Carolina work have been able to mobilize over 400 volunteers to make phone calls in Spanish. So while people may not be able to give, they're giving their time and their talents. And I'll say that right now, I need to give a shout out to my alma mater, Enloe High School in Raleigh. They have a campaign they just started a few days ago, 19 days for COVID-19. And Enloe high schoolers are raising $7,500 for Cure Americas, and they're asking 19 people to give. And I get a little ding in my email every time somebody gives, and we have about 60 people who've given. The average donation is about $8. And that goes a long way. And so not only we're trying to tell our story and let people know about what we're doing, but that we do need support, financial support. And so the Enloe Medical Bioscience Academy is going big, and I love what they're doing.
Awesome. Wow. Yeah. Well, and especially, you mentioned financial uncertainty. So as far as like messaging and like, how are you helping kind of instill confidence in those people that support Cure Americas? Like, I mean, I imagine your messaging's had to change. What can you talk a little bit about that and how you've, I guess we'll use the word pivot again.
Sure. Yeah, I think, well, one thing to keep in mind that I'm really proud of is our strategic plan from 2016 put in place a business plan for Cure Americas to not be so vulnerable because money changes. The world changes before our feet. And so part of that business plan was to build up an endowment and to build up a reoccurring fundraising campaign called the Mamathon. That's what the Enloe students are participating in, the Mamathon. We have this set up from years ago. The endowment has reached over $800,000 in cash that's producing revenue for the business. And so all that to say is that we've been thinking about this for a while, how to make sure we're not vulnerable. And so as an institution, having that long-term planning already in place has insulated us to protect us a little bit more, to make sure the donors know that we're not going away just because there's a pandemic. Just because one donor pulls out, we're going to still be here long-term. We have another 38 years to go.
I love it. I think that's so smart, Andrew. And I think that's definitely something, this pandemic is going to teach a lot of businesses is to, even if it sits on the shelf, have some sort of plan in place. You never know when something like this is going to happen, or really anything. Any business is vulnerable, especially nowadays. So I think that is so smart. I want to talk, just because I love it so much, I want to talk a little bit more about how you're helping the communities here in North Carolina. You did mention the phone campaign that you guys have going on, but can you just go into a little bit more detail about it and kind of the impact that you're seeing from it?
Yeah, for sure. And I'll go back to our strategic plan that told us, we all agreed and we asked our stakeholders that we wanted to do work in the United States. We know there are forgotten communities in our own backyard. And so we built a relationship with the Guatemalan consulate. We've been working in Guatemala for 19 years, and we went to the consulate. Actually, they came to us. We had a meeting, and they asked for help. And so we've been doing health screenings and outreach and really building a long-term relationship with them for over 3 years now. When the pandemic hit, we knew we couldn't do things in person anymore, so we had to go virtual. And so we built a online platform through Google Drive, all free, to do asynchronous recruitment and training of volunteers to make calls in Spanish. And the goal of the program was to call families who may be more vulnerable. Maybe not, maybe they are, we don't know. But we didn't want to wait for people to get sick. We wanted to be part of flattening the curve and preventing further COVID outbreaks. And we knew that the Spanish-speaking community was the most vulnerable. And the data shows it today. 45% of cases are among the Spanish-speaking community when they're only about 18% of our population. And so anyways, in March, we were making phone calls, and we were calling moms and dads in Spanish to say, here's what COVID is. Here's how you stay safe. Here's what you do in case you get sick. And also to let them know they're not alone. So many people have felt alone during this time. And by getting a phone call from a Spanish speaker in their language to say, what do you need? How do we help you? We've heard hundreds of people say, nobody's reached out. We haven't heard from anybody. You're the first person who's told us about this. I know about social distancing, but how do I do it? I need to go to work. How do I do it? I'm hungry. Where do I get food?
Amazing. Yeah, wow. Well, actually, we just had a question come in. What is the biggest barrier for folks in terms of COVID-19 prevention that you've seen?
So very good question. It differs among populations. I think for some populations is COVID real? Is it a real problem? Is it I'm going to be fine. I'm young, I'm healthy, or it's affecting other people. And so one of the things that comes to my mind personally is I don't know very many people who've had COVID personally. I don't know very many people who have gone to the hospital personally. And so the numbers don't make sense. 4 million people diagnosed, 160,000 dead. I haven't experienced that as much. I think that's the challenge. Another challenge is that people have to work, people have to live, people have to eat, people have to get their kids to childcare or, do day-to-day things. And so how do you reconcile that with also social distancing? And so many of us are very fortunate to be able to work from home, but hundreds and hundreds of thousands of people in North Carolina cannot. And the essential workers are often the people over there. Mm-hmm. And we have to remember that it's just tough for people. Life is not easy for everybody. And I feel so lucky that the word I use is gratitude, to be able to work from home and be able to keep fighting for this type of justice among people. But a lot of people have to just work. And so how do you stay safe and go to work? How do you pay your rent and stay safe?
Yeah. I feel like everyone has the same questions, but and like it's amazing that Cure Americas is able to provide a platform. I can't even like imagine not having, I'm so lucky. I can't even imagine not having those privileges, really.
Right.
So
I mean, to have the choice.
Exactly.
I have choice, and I don't have any kids, and I can work from home, and so many people don't have a choice.
Yeah. And even some, like you mentioned, some people just need someone to talk to about it too. So even just to have a shoulder to bounce ideas off of. Another question, we're getting a lot of questions, so I'm going to try and answer. This one is actually about you. How did you get involved with Cure Americas?
That's a great question. I graduated during the recession and I was looking for jobs, and I got really lucky to find Cure Americas. Honestly, I didn't know what I was going to do. I wanted to do health. I spoke Spanish, and I wanted to travel. And so, funny story, I had a job offer from a big corporation that was international, but it wasn't exactly what I wanted. And my sister encouraged me to look for jobs on Craigslist. And so I applied for an entry-level position at this small nonprofit in Raleigh on Craigslist. And they called me back. The day I walked across the stage, they gave me the job. And I started in January of 2009. And Cure Americas has really shaped who I am, the values-driven decision-making, the being led by our heart, but using our mind to make decisions and using the evidence to make sure that we're doing all that we can to use every dollar in the best way that we can. I'm really passionate about what we do, but I'm super passionate about how we do it. I think that's something that sets us apart.
And just because, Cure Americas is the first nonprofit we've had on this series. So I do want to, just touch on that a little bit. If you're willing to be, transparent about, what's been the biggest barrier as a nonprofit, like in some of these unprecedented times? Like, it's just, so different than a for-profit company. Did that scare you a little bit? What was kind of your going into this, or when this all hit? I know you've been through it before, but if you could talk to another nonprofit, what are some things that advice, I guess, you would give them?
Well, I think, I went to business school because I knew the value of running the nonprofit like a business that it is. We have needs for accounting and marketing and PR and business development and management. And so I'll just say that we are a nonprofit, but all that means is that we're values driven, profit driven. I had a call. Can you come in? Can you hear me?
I can hear you. Yeah.
Yeah. So we are a nonprofit, but we're very
much still a business. And so for me, it's really thinking about how do we prepare the business for these uncertainties and these eventualities. And nobody's replaceable. Anything can happen. All these idioms or maxims about how to run an organization are still true for a nonprofit. I think the difference is that we are hyper under resourced, always really seeking more dollars. We're very lean and we don't have a big team to support us. It's up to us, but the people on our team and the board of directors and the volunteers are incredible. I mean, that is why we exist. My colleagues, the people I work with, and the people we work with around the world are real experts and real heroes. And so I think that's what allows us to keep pushing forward. We're doing something that we care about, and we're doing it well.
And how, like, internally, how has, besides a lot of things going virtual, has your communication shifted much, as far as communicating with those people you have on the ground overseas who, I talked to a volunteer a couple weeks ago who was supposed to be home and she wasn't able to make it home. So how has that communication shifted for you internally for your team?
That's a great question. What's interesting is I was meeting with the head of our project in Guatemala recently, and he was talking about next year, 2021, we're planning for, and he said, I didn't think this would work, Andrew, but this new modality of virtual work is working for him and his team. And so our experts, public health experts, Barbara and Ira, are able to do training using Skype or WhatsApp or different tools. And I would say 6 years ago, that would not be possible just because of the infrastructure. We have this thing that we do called a partnership symposium where our partners from around the world come together virtually. And we started that about 4 years ago. And it was really hard for a Liberian health worker to access internet and the bandwidth to do a conference call. That was really tough, and the infrastructure is only getting better. And so I would say today what's really neat, and I think this is true for a lot of businesses, is that the new normal is shifting. Working remotely, working from home, saving money there and spending it in other places is working. And so I think one of the things that we've always emphasized as well, separate from this ability to work remotely or virtually, is our long-term commitment to our partners. And so we have re-emphasized that. We have put our money where our mouth is by saying this is an emergency, and so you need emergency support, and we are still in an emergency, which means paying for things we didn't budget for, PPE, paying for things and training that we didn't plan on, and not letting that get in the way of making good decisions now. And I think that type of long-term commitment has been really important as well.
Yeah. Well, I commend you guys. I mean, can't even imagine pivoting an entire project site across the country. I'm amazed by you. And actually, someone just asked, amazing work. How can we help? Where can we donate?
It's a great question. CureAmericas.org. There's a donate right there on the website, CURAmericas.org. But we need help for volunteers as well, English-speaking volunteers, Spanish-speaking volunteers, remote, asynchronous, live, in-person. We definitely need help because we're reaching, if you can believe it, 8,000 people so far we've reached this year in Spanish with volunteers. And that is a program that is brand new that we bootstrapped ourselves pretty much overnight. And then around the world, we're reaching, over 100,000 people, thousands of moms and babies to provide preventative health. And I'll just say that the Lancet Medical Journal, a leading international peer-reviewed medical journal, published recently how they expect moms and babies to face a harder time now because of COVID. Doctors are not available, medical supplies are not available, people are scared, and prenatal care is harder to come by. And emergency contraception, emergency care, emergency deliveries are harder to come by today. Communities are shutting their borders. Literally out of fear for COVID, they're putting rocks across the road or trees across the road so people cannot leave or enter the community, which makes all of our work harder. And so while we're focused on COVID, just the other day, 2 twin babies were born at a health facility that we support in Guatemala. And our head nurse said, we're still here. Moms are still giving birth.
Amazing.
There's still work to be done.
Amazing. I am really proud to be part of the work that you guys do. I enjoy it every day. So thank you. We have so many questions that have come in. I'm sorry if we didn't get to them all, but we can work to answer them offline as well. I do encourage everyone also to follow Care Americas on their social media platforms. You know, they're on Facebook, Instagram, LinkedIn, all of them. But they post daily updates on ways that you can help, again, how they're pivoting through the pandemic and the impact that they're making across the world and in North Carolina. So it's 3:56, Andrew. Anything else that you want to touch on? I know I want to be cognizant of your time.
Sure. Well, I just want to give a big shout out to all of the people who are part of this. McKeeman, your team is incredible. Our board of directors are leading us and making us better every day and encouraging me and our team, my colleagues, and I can't overstate this, healthcare heroes that I work alongside of, people around the world who are making the world a little bit better. We all have an obligation to do our part. So keep fighting. Everybody on this phone, on this Insta Live, keep fighting to make our world better. We have to do it.
I agree. Awesome. Thanks so much, Andrew, for joining us. And we will definitely post this, and I'll share the link with you so that you can share it with your followers as well.
Awesome. Thanks, Shannon.
Thanks,
good to see you.
Have a good one. You too. Bye. Well, thanks everyone for tuning in. We'll be sure to post this to our Instagram TV channel. We will answer some of those other questions off the live, if only there was more time. But don't hesitate to reach out to our McKeeman team if you have any questions, or if you know of someone who might make a great Instagram Live guests. We're going to continue the series into August. Reach out to us through our website or our social media channels. Again, thanks for joining us, and we will see you in August.